Respiration systems, that is very important systems. That's basically all oxygen through the respiration systems going inside bodies. That's for our life. Must be health. It must be health. Then we see respiration systems. Generally speaking, including two parts. One part is tract part or tube part. Another part is the organ part. Organ part is the lung. So that's respiration systems. But the tube part, we still separate another two parts. Upper respiration tract and the lower respiration tract. Upper respiration tract, including the nose, including the pharynx. The same meaning. Usually we're talking about the throat. And including the larynx. Larynx also the voice box. Lower respiration tract, including mainly is the trachea and the bronchiole. So that's we say respiration systems, all including in there. All included in there. So that's the general information about respiration system. Then we will talking one by one. We will talking one by one. We start from the nose. We start from the nose. When we looking this picture, so respiration systems start from the nose, and from the nose cavity, the air go in, and passing the pharynx. That's usually we talking about the throat air. And then go down. That's the larynx air. We also call it a voice box. Then go down. This part we call trachea. And then connected lower part of the trachea. That's we call bronchi. But when the bronchi go to inside the lung, they will bunch it. That's usually we call bronchiole. So now let's start from the nose, talking about some detail here. The nose, mainly we talking about the nose cavity. Means inside the nose we have some space there. We can see the picture here. So we see sagittal plane. Sagittal plane. Looking by side. That's the open part of the nose here. The air coming in from open part and then go to inside the nose. We have a big space there. That's we call nose cavity. This nose cavity is separated by left side and the right side. they separate from the center. So we have two nose cavity. Two nose cavity. Left side and the right side. So air go in from here and then passing through nose cavity and then downwards finally go to the lung. So thus we say, thus the air go in the body through the nose open part, nose trust. Open part, we give it a name, nose trust. And then immediately go in, and that's basically on the roof part of the mouth, above the mouth. And then separate two space there. That's we call nose cavity. So nose cavity, we say we have two space there. It is separate by another structure here we call septum. By this septum or nose separate with two cavities. So that's basically our nose. Root part of nose formed by bone, and the frontal part of nose formed by the cartilage, or soft bone there. And inside the nose cavity, they have mucosa membranes. And each side of nose cavity, on the side part, they have three like a bump there. If you look in here, you can see three small bump here. These three bump, we call it tubernates. By these three bump, they separate a big nose cavity to three separate passing root, but in the middle part, they still connected each other. So in this way, increase the superficials, like the nose cavity membranes there. So later on, we will talking about the functions. We will talking about the nose will have warming air functions, warming and moistening air function. So when these superficial membranes increased, they are easily warming and moistening air. Make the air go to inside the body is not that cold air anymore. It's getting warm. So that's the nose cavity part. Then we're talking about another important part, relationship with the nose. That we call sinuses. What means sinuses? Sinuses is a small space or cavity. They are inside the bone, inside the skeletal bone. And then inside they still cover with mucosa membranes, pretty similar like the nose. And they also open to the nose. So Everybody have 4 pair of sinuses. Inside the frontal bone, we have frontal sinuses. So like a picture here, yeah, each side have 1. That's why we call pair here. And another bigger one, inside the maxillary bone, we have another pair of sinuses. Remember, sinuses is the space inside the bone, but they open to the nose. So these 2 pair is more bigger and more superficially. Then we have another 2 pair. Basically, is more deeper. Sulfurate sinuses. That's this one. If we're looking from the side, you can see how deeper it is. Another sinus is small one, basically is here. Let's see another picture, maybe a little bit bigger here. So if we're looking from frontal, that's frontal pair, that's maxilla pair here. Another 2 is more deeper, look like a little bit small here. But they all open to the nose cavity. So that's clinically, some people pretty easily got infections in sinus area. We call sinusitis. Yeah, sinusitis. So that's basically in the nose part. Yeah, in the nose part. Then we go down. Go to back of the nose. Yeah, go to back of the nose. We call it a pharynx or just the throat. Pharynx is a muscular kind of organ there. So that's the air passing through the root to the respiration tract. They also the root food passing through to the digestion system. So we can see the picture here. All these parts we call pharynx. But the pharynx also separate with 3 parts. Mainly behind the nose, like the yellow color here. We call nasopharynx, behind the nose. And the blue color here, behind the mouth, we call oral pharynx. And behind the larynx, we also call voice box here. That we call laryngopharynx. Pharynx is the orange color here. So that's we say they separate with 3 parts. So mainly air coming from the nose and passing all of these kind of 3 parts, then go to the trachea. But the food coming from the mouth, then passing through oral part, and then go to behind the larynx, go to digestion systems, like this way. So that's we can thinking about how they can working like this way. Why food not go to the trachea? Why the air usually go to the trachea. So basically, important part, we have a special cartridge here. That's working like a one-way door. Yeah, that's working like a one-way door. Normally, they will be open. Yeah, this air is open here. But when we eating something or tongue, pushing it back, so it will cover the trachea here. Then the food will go to digestion systems here. So that sometimes happens, like people speak and then they eating something by accident, some food dripping into the trachea, then they will cough. So that's because your nervous systems, your body little bit confusing. Don't know if you try to eating or if you try to speech. So better when you're eating something, don't speech. When you speech, don't eating things. Otherwise, you make your body confusing there. So that's we say in the pharynx part. We separate the three parts there. They mainly functions just passing the air and passing the food. So that's basically pharynx is nothing special. Yeah, nothing special. But the important part is passing the air and passing the food. And this can special separate the route, sending air to digestion systems, sending air to respiration systems, sending food to digestion systems. So that's like a larynx part. Now we go to the larynx part. Yeah, now we go to the larynx part. Larynx part and the pharynx part. Yeah, and the pharynx part. So that's basically this part here. This part, they have a very important functions. Can make the voice. So that's sometimes we also call it voice box. So under it is trachea here. This picture we're looking from the top. This is the cartridge we say like a one-way door there. Yeah, epiglottis. And here is we call voice box. So we have two vocal cord here. This kind of movement can make the voice, like the air passing through and then make the voice. So basically the air coming from the lung and go out, then make the voice there. So that's we say the larynx here. Yeah, larynx we also call voice box. Located between the pharynx and the trachea. Lower part is the trachea. Upper part is the pharynx. It is formed by cartilage. And the big cartilage here, yeah, this one, big cartilage here. Because they're located very close to thyroid gland. So thus we name it serrate cartilage. Yeah, serrate cartilage. And this bigger part, we also call Adam apple. Thus belong to part of the serrate cartilage. So this part usually is bigger in the male and a little bit smaller in the female. So thus mostly we can see on the male person, they will have a pretty bigger like a knot there. That's we call Adam apple. Adam apple. It's a kind of story like Adam eat apple and didn't swallow down, and then make a big like tuber there, but not true. It's not apple. It's cartilage. And inside we have vocal cord. That's make the voice. So that's the larynx part. That's the larynx part. Then we still go down. Yeah, we still go down. Go to the trachea. Yeah, go to the trachea. Trachea also called windpipe. Like the air passing through. Go in, go out. So separate from here, we say upper part we call larynx. And connected with larynx, yeah, basically this one including to here. This part we call trachea. Trachea is the tube. Upper part connected with larynx. And it located in the upper part of the chest. They say about the heart. Let's see if we have the heart picture here. So from this picture, yeah, we can see that's the heart located here. So that's the meaning about the heart. So trachea from here to here. That's the trachea. So that's the location in the center of the body, upper part of the chest, above the heart. And the trachea, it formed some cartilage inside. Cartilage can keeping the trachea always open. We're talking about the trachea. If we're looking from the top or transverse blood, the cartilage like this way, like a C shape. Anterior part is the cartilage. Posterior part, small part, is formed muscular muscles, smooth muscles here. So muscular kind of tissue, we know they can contractions, relaxations. So sometimes they may be small, sometimes may make it bigger. So that belong to our digestion systems. If we swallow food, they make bigger. If we are not eating, they just small here. That's behind the trachea. So that's the back part. That's the front part. But the trachea, they always keep open because they have cartilage holding them. So that's normally the air easily go into the lung, and the carbon dioxide is easily coming back because we have trachea. It's totally open there. Trachea is a very clear space, nothing inside. They are not allow anything go to the trachea. If anything go to the trachea, will cause people cough. So cough is kind of a protection functions, keep everything clear inside. Then we still go down. We still go down. We say this part belong to larynx. This part belong to trachea. Then we still go down. We can see the trachea separate two branches here. One go to left side. One go to right side. These branches here we call pulmonary bronchi. Two, left side, right side. And from there, they bunch it again, bunch it again, bunch it again. So that's we always talking about that kind of opposite kind of tree in there. So we call it a bronchi tree. Bronchi tree. So secondly, coming from pulmonary bronchi, we call secondary bronchi. Then we got more smaller. Finally, we call bronchioles. So that's the bronchi and the bronchioles. So from the trachea, we divided into two bronchi first. These two bronchis, they shape little bit different. So right bronchi is a little bit bigger or wider. You can see the picture here. The diameter a little bit bigger compared with the left one. And also we're talking about the angle here. The angle with the trachea is more bigger, right side compared with left side. So that means if something by accident, by inhale, go to the trachea, like the children play something, put some toys in their mouth, then by accident, the inhalation, follow the inhalation, go to the trachea, and then they falling down. Mostly, they will go to right side of the bronchi, or go to right side of the lung. So that's why sometimes accident happens. They always go to right side easily because the diameter here is more bigger and the angle here is more bigger, so everything is easily go to this side. Then basically, the bronchi tree located inside the lung. They go to lung part. Yeah. Not only the bronchi there, also have like blood vessels there. Nervous branches go in the lung. That part we call hilus. Hilus just means kind of door in there. Bronchi go in, nerves go in, and blood vessels go in. So that's the part. Yeah, that's the part. So that's the bronchi and the bronchi tree. Respiration systems, including two main parts. One is the trach or tube. One is the organ. Organ is the lung. So we finish upper respiration tract, including the nose, including the pharynx, including the larynx. We also finish the trachea and the bronchia. Now we especially talking about the lung. Lung is the organ of the respiration systems. Everybody have two lungs. They located in the chest cavity. One on each side. They separate the lobes. Left side, they separate two lobes. Like a separate from here, upper one and the lower one. On the right side, they separate three lobes. Upper one, middle one, and the lower one. Yeah. Generally speaking, right side lung is a little bit bigger compared with left side lung, because left side or heart mainly located. They occupied some space in there. So inside the lung, we say bronchi go to the lung at the hilux area, means the open of the lung area. That's both sides. And then they bunch it again. So they bunch it, go to 3 bunch on right side and 2 bunch it on left side first. Then they bunch it again. Form the bronchi tree. So inside the lung, part of them just the bronchi tree there. And they bruncate or divided again. And finally, they have pretty tiny small, we call bronchioles. Certainly, bronchioles we are not able to look in with our naked eyes. We need to use microscope, then we can see the bronchioles. But the pulmonary bronchi area, we can see it. Yeah, pulmonary bronchi area, we can see it. So that's generally we're talking about the lung part formed by the bronchi tree. In the bronchs, they still have small kind of cartilage in there. We say the cartilage, the functions, they can hold in the space there. Make sure the air can go in and go out. And then when they go to smaller, the cartilage getting less and less and less. We say finally the smallest one we call bronchioles. In bronchioles area is totally no cartilage. That means only smooth muscles holding that space. So that's normally they still keep open because it is smaller. Even without cartilage. And it controlled by the automatically nervous systems. But if patient have some troubles like asthma kind of patient, mainly they cause some smooth muscles in the lung contractions, especially in the bronchioles area. We don't have cartilage. Other place, bronchi tree, they smooth muscles still contractions, but the cartilage can hold in some space there. But in the bronchioles area, we don't have smooth muscle, we don't have cartilage there, only smooth muscle there. When they contractions, they can totally kind of block you there. So that causes people very difficult to breathe. So that's by the anatomy of the lung and especially the bronchioles area. Then we say they bunch it. Finally, it's the bronchioles. And connected with the bronchioles, we can see it's kind of model here. It's not truly the lung tissue here, but it's kind of model here. You can see on the ending part of the bronchi tree, they will connect some air sacs there, like the grub, like we're eating some grub. So this area, connected with ending part of bronchi tree. So that's we call it alveoli. Alveoli. Like all together we call alveoli. A single one we call alveolus. So this bronchi tree, ending part of the bronchi tree. Is connected with terminal kind of bronchioles. And then they connected a group of the air sac. Pretty similar like grubs. So that we call alveoli. And if single one, we call alveolus. So in the alveolus, That's formed by single cells. It's very, very thinner wall in there. So that's the gas easily passing through. When we're talking about gas here, mainly is oxygen will go in and carbon dioxide will go out. So that's mainly happens in the alveoli. And the blood vessels in the tissues we call capillaries. So blood vessels in the alveoli also. So that's the place air passing through. Yeah, air passing through. So that's you can see the picture here. That's the remember circulation in the lung is totally different in other part of bodies. Blue one here is pulmonary artery. It's low oxygen kind of blood in there. We say we separate artery and vein. We say carry blood away from the heart. That's we call artery. Most artery is rich oxygen kind of blood, but accepted pulmonary artery. So pulmonary artery is low oxygen kind of blood. Then they go to the capillaries in the alveoli area. In that area, we say they take in oxygen and relieve carbon dioxide. Then the blood will have more oxygen inside. So that's red color in here. But this blood will return back to the heart, to the left side of the heart. So that's we call vein, pulmonary vein. So pulmonary vein is rich oxygen kind of blood. So only in the pulmonary circulations is a difference with systematic circulations. Systematic circulation, artery is rich oxygen kind of blood, and the vein is low oxygen kind of blood. But pulmonary circulations, pulmonary artery is low oxygen, pulmonary vein is high oxygen kind of blood circulation. So that's blood circulation. When we talking about the circulation systems before, now you can connect it with respiration systems. So respiration systems is more close relationship with circulation systems. So the blood, we say, coming from right side of the heart is low oxygen kind of blood, but we call pulmonary artery. They go to the lung. And then in the lung alveoli air changing. Then high oxygen kind of blood return back to the heart, to the left side of the heart, then sending through the aorta, biggest artery, to all of the bodies. So that's pulmonary circulation here. So that's our lung part. Yeah, that's our lung part. So we say lung part composed partly is bronchial, partly is alveoli. Partly is alveoli. That's the forming of our lung. The last part, respiration systems, we're talking about the lung cavity. So lung cavity is not truly lung cavity. So basically, it's a chest cavity there. It is separated by the diaphragm with abdominal cavity. But during chest cavity, we have the heart in this area. And we have lung. So generally speaking, for the lung, we have a special cover. Just like the heart, we have pericardium covered. For the lung, we still have a special covered we call pleura. Pleura is the cover of the lung. So still two lungs there. One lung directly touching for the lung superficie of the lung. And they have pretty small space between these two lungs. Another lung touching inside of the chest wall there. So just small space between it. And touching the lung, we call visceral pleura. Touching the wall of the chest, we call parietal pleura. Between these two spaces, basically it's not like these two big space, just tiny space there. And a little bit fluid, performing some moistening function in there. So that's we call the lung cavity. Lung cavity. Basically, just in the chest area, we have pleura cover for the lung. This part very important for our respirations because between these two lungs here is negative kind of air pressure. So that make people inhale is easily. Inhale is easily. And we can take air go in.